So in today's session, we will be focusing on vitamin A deficiencies and disorders, fat soluble vitamins, part 2, vitamin A deficiency disorder. That's the chapter name. Those who have the textbook, page number 301 onwards, chapter 16. If anyone is joining late, please help them out with the page numbers. We'll start today's session. Vitamin A. Basics of vitamin A we have took in our last week's class. Those who are new students here, you can check the recorded sessions link. And again, the chapter will be repeated in a while once we finish our syllabus. Okay. So it will be redone. Don't worry about it. Still, you have access to the contents of the presentation from the recorded sessions link. Okay. So on on a yearly basis and also on a 10 yearly basis, National Nutritional Monitoring Bureau in India, okay, they keep collecting data from various healthcare facilities and hospitals, CHCs, community health centers, primary health centers. Okay, they keep collecting data to indicate how many of the how which part of the Indian population is suffering a lot from vitamin A deficiency. And epidemiological data, okay, epidemiology, study of population. Okay, so when we talk about National Nutritional Monitoring Bureau, they are also a part of epidemiology. They are studying the population by collecting data on disease variables. Okay, so it has collected the data. Based on the data they have collected, Indian preschool children, okay, consume less than 50% of their total recommended intake of vitamin A. Okay, so preschool, specifically preschool age group of population, okay, they suffer majorly from vitamin A deficiency. And the bite spot also will see that in later sessions, okay, in coming up slides, okay, which part of the deficiency, which stage of the vitamin A deficiency you will get spot. So in all the states of India, except the states of Kerala and Orissa, okay, based on the data of 2003 to 2004, except for the state of Kerala and Orissa, in all the other states of India, bite spots prevalence was seen, which means the preschool kids were severely deficient in vitamin A. Okay, night blindness is also seen among preschool children. Okay, different stages of vitamin A deficiency is seen in majorly preschool children. Okay, so epidemiology, when we talk about epidemiology, what do you mean by epidemiology? When you study your population, okay, studies done on population, data collected to make an inference about your population. Okay, we know that India ranks first when it comes to tuberculosis. Okay, still it ranks first when it comes to tuberculosis. How did we get that data? Because studies was done, data was collected. Okay, every tuberculosis disease cases, whenever it comes to hospitals, it is reported to the national bureaus. Okay, so when you collect these reports one after the other, you will get to know which disease condition is the most prevalent one in India, which is more prevalent in your neighboring countries. Okay, so even how many people were affected by COVID. Okay, which part of the population is majorly affected by COVID, which state. Okay, all these datas, when you get, you do it through epidemiology. You study the population, you collect data, and you make inferences out of the population. This is what we call as epidemiology. Okay, it is a completely it's a very vast subject when it comes to MBBS, nursing, physiotherapy, and all. Okay, these major medical faculties and the practices. Epidemiology is a very vast subject which they have to study. Okay, community health medicine is also completely dependent on epidemiological studies and all. Okay, so age. Vitamin A deficiency is more common in children, specifically preschool children. Okay. It is rare during infancy because maybe the child is immunized, and preschool children, that is after the age of 5. Okay. Before the age of 5, 3 years old to 5-year old, they are considered as preschool children. They may not be getting their immunization done. Okay. In infancy, majority of the vitamin requirements are fulfilled by mother's breast milk and all, and weaning diet is also nutritious. So during infancy, it is very rare to see children with vitamin A deficiency, but preschool children are at higher risk. Corneal lesions, night blindness. Okay. These are, however, seen in children who are above the age of 6 years of age, school children. And any child who is affected by severe acute malnutrition, okay, or severe protein energy malnutrition, these children are also at a higher risk of developing vitamin A deficiency. Then we have socioeconomic factors. Children who are from rural India, tribal families, who come from low income group, BPL families, below poverty line families, they are more vulnerable to vitamin A deficiency. Okay. And these cases are very common in remote villages of India as well. And mothers also, if the mother is vitamin A deficient, there are high chances that the child she may bear will also be vitamin A deficient. Okay. Illiteracy also contributes towards this deficiency. Not having awareness about the importance of diet during pregnancy. Okay. These things also contribute towards significantly contributes towards the deficiency. So etiology, what do you mean by etiology? Causes. Why does it happen? Etiology is a medical terminology. It means causes. Why does it happen? What are the causes of vitamin A deficiency? Okay. First is inadequate dietary intake. Vitamin A deficient diets are consumed usually by pregnant women and lactating mother, and that's the result that offspring is first of all born with poor liver stores, because vitamin A is a fat soluble vitamin. Okay, so whatever is a fat soluble vitamin, usually it is stored by your liver. And if the mother during her pregnancy was not having enough vitamin A, definitely when the fetus is being developed in her body, within her womb, fetus the fetal liver is being developed with very poor stores of vitamin A. So naturally, the child is born, first of all, born with poor stores in the liver, vitamin A stores in the liver. And even during infancy, mother's breast milk is supposed to protect the child from vitamin A deficiency. And again, during the uh, uh, lactating period, and even during the weaning period, when the child is given breast milk, but on top of breast milk, additional food is also given to the child during that period as well. If the mother's diet or the weaning diet is inadequate with vitamin A, that could also lead to hypovitaminosis A or vitamin A deficiency. And if you include more eggs, okay, more eggs, milk, fortified milk, liver in a infant's diet, okay, that can solve the cases. But eggs, milk, non-vegetarian food usually are expensive for the poor communities in India. They usually depend on plant-based food. So that only provide pro-vitamin A, but not the active form of vitamin A. Okay, the active form of vitamin A, which is much better absorbed in human body, comes from non-vegetarian sources or animal-based sources like milk, eggs, meat, liver, and all. Okay, plant-based sources all has vitamin A, but in form of provitamin A or beta carotene, alpha carotene, and so on, which has to be converted. It is absorbed by the intestine, but it has to undergo certain conversions. Okay. So the bioavailability of plant-based sources of vitamin A is naturally lower as compared to animal sources of vitamin A. Okay. Then inadequate intestinal absorption. So ghee and curd has negligible amount of vitamin A until and unless it is fortified. If the ghee and curd is fortified, if you get it manufactured, if you get the manufactured ones, the manufactured ghee and all, usually it can be fortified with vitamin A. Okay, vitamin A and D. Oils usually in India, oils, milk, ghee, okay, they can undergo vitamin A and D fortification. Okay. Also, essential for fatty acid fortification can be done for oils, ghee, milk as well. Okay. So, inadequate intestinal absorption, if the child is suffering from a lot of recurrent infections, okay, like malaria, measles, diarrhea, pneumonia, okay, any hookworm, tapeworm infestations, worm infestations, okay, in such cases, intestinal absorption of vitamin A will not take place adequately, okay. Then increased excretion in case of diarrhea, okay, too much of fecal loss, and if any UTI is there, urinary tract disease, cancer, any infectious disease is there, the child will excrete a lot of vitamin A. Then ignorance, females, majorly from rural India, okay, or below poverty line families, if they are illiterate, and if even illiteracy is not a major problem, but not having awareness, okay, and ignorance are there, they do not understand the importance of supplementation, supplementary diets provided in all the government faculties, okay, they do not know vitamin A rich food, which are the rich sources of food they should consume during pregnancy. Okay, when females don't have this kind of awareness, usually it leads to vitamin A deficiency. Then improper methods of cooking, boiling the food for a long time at high temperatures. Okay, that can destroy carotene. Especially majority of the Indian diet is plant-based food. Okay, so cooking for long period of time and deep frying, boiling for too long, okay, these can destroy beta carotene. And vitamin A can be lost by oxidation also. Oxidation means burning. Next, coming to the levels of vitamin A status. So this is the medical part, okay. From a clinical point of view, how do you understand if a person is uh, if any person is deficient or not, okay, in vitamin A. So preclinical deficiency can be checked by a biopsy can also be done of the liver to identify how much wet weight of the liver has vitamin A. Okay, so if when you do this biopsy, when the liver's biopsy is done, and less than 0.07 micromole per gram wet weight of liver has vitamin A, it means the person is deficient. Okay, otherwise you don't have to do biopsy. Even if you do a regular blood test, okay, you can still understand if the person is having vitamin A deficiency or not. Satisfactory levels for a 75 kg male, if they have 0.18 micromole wet weight of vitamin A in their liver, it is satisfactory. And in females, if it is 0.114 micromole of wet weight of liver, it has vitamin A, that is also completely fine. So these two are clinical terms. Okay, from clinical point of view, how do you assess the vitamin A deficiency to be very sure of it? Okay, coming to the clinical features. So deficiency, these clinical features will show up only after the vitamin A storage in your liver is depleted. Okay, even in your liver, when the vitamin A storage gets depleted, that's when slowly you will start seeing the symptoms. So first symptom is the effect on eye. nutritional blindness we say, or night blindness. Okay, at night your vision is sketchy. Okay, and especially when you move into a room from a bright room, when you move into a dark room, it is difficult for your eyes to adjust to the new dark room. Okay, it takes time for your eyes to adjust to the darkness. Okay, that is one way of identifying that you may have vitamin A deficiency. So your eyes get affected. Xerophthalmia, dryness of the eye, is also another situation seen in vitamin A deficiency. It affects your conjunctiva, your cornea, retina as well. Okay, these are different parts of the eye. Those who have the textbook, a small anatomical session on eye is given. So from there you can understand the white part of your eye is conjunctiva. Okay. Then the round, the black part of your eye, the dark part of your eye is the cornea. Okay. Retina, you cannot see, it is at the behind of your eye. This is, retina is where the images are formed. Because of retina, you are able to see things. Okay. There are different stages of night xerophthalmia. We'll see that later. Okay. The next effect is effect on growth. So because of vitamin A deficiency, growth retardation can take place, because even for your skeletal system to form, bone formation, for your bone to lengthen, okay, to grow in size, vitamin A is required. Okay, so deficiency can lead to growth retardation, stunting. Then effect on reproduction. Even the reproductive system in males and females both can be adversely affected. And if a pregnant mother is severely deficient in vitamin A, it could lead to miscarriages as well. Okay, spontaneous abortion, miscarriages also can take place due to fetal death or other reasons. And in males, sperm production will come down. Okay, because uh, the germination of new sperms, it requires vitamin A, presence of vitamin A, and if there is no vitamin A, germination of new sperms will not take place. So the sperm quality and quantity will reduce. Okay, so that's how it affects the reproductive health. Then you have the increased susceptibility of infection. Why? Um, you see your eyes, your nostrils, your mucous membrane, wherever you have epithelial cells. Okay, your the lining of your mouth. Okay, the lining of your esophagus, lining of your trachea, the lining of your intestine. Okay, they all have epithelial cells. Even the skin, okay, your skin is also covered with epithelial cells. Okay, so when vitamin A is not there, epithelial cells will not generate. Okay, epithelial cells, they get old, they shed off, and new epithelial cells will replace the old one. This takes place. Okay, but when you don't have enough vitamin A, this replacement will not take place. There are no new epithelial cells being formed to replace the old one. The old ones will stick to the usual site. They will get harder and they will get dry and hard. Okay. So what happens is that the epithelial cells will not be able to function properly, keep the inside lining of your esophagus trachea moist. Okay. They will not be able to secrete mucus. As we know, the mucus secretion of your trachea, your esophagus, intestine, in your nostril, these are the first line of defenses. Okay, and if the epithelial cells are not able to uh, stay moist, secrete mucus, okay, and protect the lining or insides of your body, you will be susceptible to infection. Okay, you will get infections again and again. Okay, this is how vitamin A deficiencies can lead to infection. Then risk of preterm delivery, pregnancy-induced hypertension, anemia. That is also quite common. Preterm delivery, all the pregnant mothers who are deficient in vitamin A may undergo preterm labor. Okay. PIH is pregnancy induced hypertension. The woman was not having BP or hypertension before pregnancy, but as soon as she got pregnant, during that 9 months, 9, 10 months of pregnancy, she is suffering from high BP, high blood pressure. Okay. Vitamin A could lead to this condition, anemia as well. Okay. Spontaneous abortions can also take place, moderate to severe anemia, especially when the serum vitamin A levels, retinol levels are less than 20 microgram per deciliter. Okay. So this is considered as a cutoff limit of vitamin A deficiency in women. Why anemia? Because vitamin A is essential for your iron absorption and utilization. Okay, if vitamin A is not present, iron absorption will not take place. And if iron absorption is not taking place, anemia may happen. Okay. So is it clear all the clinical features? Is it clear how vitamin A deficiency can affect your health? Not just the major deficiency, major sign of night blindness, but apart from that, is it clear to all which all areas of your health will be affected because of vitamin A deficiency? The temperature required to cook food, plant-based food, it depends on what kind of plants you're using. Okay. If it is green leafy vegetables, do not cook whatever method of cooking you're choosing. Okay. Do not fry green leafy vegetables. Sauteing is fine. Okay. Blanching is fine. Boiling is also fine. But do not cook your green leafy vegetables more than 5 minutes. Okay. Under 5 minutes, your green leafy vegetables are cooked. And whenever you are cooking any plant-based food, make sure a bite, except for the starchy ones, except for the starchy roots and tubers, okay, all the other vegetables, a small amount of bite should be there when you bite into the cooked vegetable. Okay, it should not be completely mushy. Okay. So coming to the stages, different stages of xerophthalmia. Xerophthalmia means, zero means dryness. Ophthalmia, eye. Okay, related to eyes. So xerophthalmia is different stages of dryness in eyes. Okay. So uh, abbreviations are given. You don't have to by heart these abbreviations. Okay. So this is the stage in which stage after stage when the vitamin A deficiency deteriorates, not getting treatment. Okay, you are deteriorating your vitamin A deficiency levels one after the other. Your deficiency signs and symptoms will get worsened. Okay, so it starts with night blindness, then it goes to conjunctival cirrhosis, bitoid spot, corneal cirrhosis, corneal cirrhosis onwards. Corneal cirrhosis onwards, whatever happens cannot be reverted back. Okay. Night blindness can be reverted back. Your vision can be improved. Conjunctival cirrhosis, take medication, take supplementation, vision will be improved. Bitoid spots can be treated. Corneal cirrhosis, within few hours, if it is not treated, it will lead to blindness. Corneal ulceration, blindness, complete blindness, cannot be reverted back. Okay. Both the stages of corneal ulceration, complete blindness, corneal scar also, complete blindness, cannot ever be reverted back. Xerophthalmic fundus also, complete blindness. And there is a specific kind of night blindness that happens during pregnancy because of deficiency of vitamin A. It is called maternal night blindness. During pregnancy, it happens. Okay. So these are the different stages of xerophthalmia. So after this slide, I will be showing some images. Okay. Some people may find it discomforting to see the images. Okay, you can just at least listen to the class if you don't want to see the slide. Is it clear to all? It will be the different forms of ulcerations seen in different stages of xerophthalmia. Okay, only if you're fine with seeing these images, you can continue watching the slides. Otherwise, you can just remove the screen and just listen to the class. That is also fine. Is it clear to all? So first is night blindness. So you can see how a normal vision would be and how a person who has night blindness, how their world looks like at night. Okay. So usually what do you mean by night blindness? The speed with which the eye can recover to its full powers after being exposed to bright light, and then it is exposed to dim light. Okay, when you shift from brightness to dim light, okay, how soon your eyes can recover its vision. Okay, how soon your eyes can adjust to the new lighting. Okay, that determines are you night blind or not. Okay, if a person is night blind, it takes them more time, if it takes their eyes more time to adjust to the new dim light. Okay, so it completely depends on your dark adaptation. Okay, if the recovery process of dark adaptation is too slow, it means you may be suffering from night blindness. And people who have vitamin A deficiency, they will find it difficult to see their way in a cinema theater. Okay, when the lights are dim, when you go to into a movie theater, lights are dim, you have to find your seats. Okay, for a person who has night blindness, it is very difficult for them. They may trip and fall on the stairs. Okay, they can't see the stairs in front of them. Okay, but those who have sufficient amount of vitamin A, they can manage through a dark theater pretty pretty well. They will have a minuscule amount of vision, which is enough for them to get through the theater. Okay, and even in dim light during dusk or during dawn. Okay, dusk is the evening time, dawn is the early morning time. During these times also, people who are deficient in vitamin A, they will not have a good eyesight, okay, during these times of the day. And it is reversible. Night blindness is reversible. Mild deficiency of vitamin A that leads to night blindness, it is completely reversible. Start eating vitamin A rich food. Okay, if it is prescribed, start having vitamin A supplements. Your vision will revert back. Then we have conjunctival xerosis. So in conjunctival xerosis, dry patches are seen on the conjunctiva. You can see here this white area. Okay, usually when you look at your healthy eyes, okay, it will reflect back light. It has a very smooth surface. Your conjunctiva should always be very smooth. Okay, it should appear wet. It should appear wet, and tears should be there in your conjunctiva, keeping it moist. Okay, it should appear wet. But in conjunctival xerosis means, as I mentioned, dryness. Okay, dry patches are seen, and you can see it is wrinkly. Okay, it has folded. It does not have that shine, luster, and shine that a normal conjunctiva would have. Okay, and various degrees of thickening and wrinkling and pigmentation is seen. You can see here some part of the conjunctiva is yellowish, some other part is, this area is whitish, the other area is yellowish in color. It is wrinkled up. Okay, usually conjunctiva should have a very smooth surface, but here it is wrinkled up, muddy colored, and it gives a smoky kind of appearance. You can see here conjunctiva and the cornea. Okay, where these two are meeting, it has a very smoky appearance. But when you look at your own eyes in the mirror, okay, when you look at your own eyes in the mirror, there is a clear cut difference between your cornea and the conjunctiva, but it is here kind of blending into each other. This is giving a smoky kind of an appearance. Okay. This is also reversible. Conjunctival cirrhosis is also reversible with proper nutrition and supplementation and medical aid. It is reversible. Drops, some eye drops will also be given, okay, to bring back that moisture in the eyes. Next, we have Bitot spots. Okay. So Bitot spots, it may come in two ways. Okay. This is also a Bitot spot. These two are Bitot spots. It is triangle. Sometimes it is, usually it is triangular in shape, Bitot spots, but it can come in various shapes as well. It gives a chalky appearance, a matte chalky appearance, and these white spots are seen on the conjunctiva. Some Bitot spots may be brown in color, sometimes it is white in color, but in major cases it is white in color. Okay. And they differ in size, location, shape, but usually they are triangular in shape. Sometimes it will appear foamy, cheesy, mattified material which is stuck on the conjunctiva. Okay. And these are also reversible. At this stage also you can still reverse your situation. And it is easily diagnosable. And teachers who are school teachers, okay, if you are teaching preschool children, okay, children up till the age of 10-year-old, okay, 3 to 10-year-old, if you're dealing with kids who are between this age group, it is easily noticeable. The school teachers are under the nutritional prevention, vitamin A prevention programs and all. School teachers are taught how to identify Bitot spots in the children and find their family, talk to their family, guide them with vitamin A deficiency. What is it? Make them aware of the nutritional value of vitamin A rich food. So school teachers are usually the mascots who can identify the Bitot spot in their classroom, in their students, whomever they're teaching, and spread the awareness to the students as well. And to the student through the students, they have to spread the awareness to the families as well. Okay. And then you have corneal cirrhosis. Bitot spot is also reversible, as I mentioned. In corneal cirrhosis, till now, everything was happening till the conjunctival level. Okay, conjunctival cirrhosis, Bitot spot, it was in the conjunctiva. Now your cornea is getting affected. Okay, cornea, this is the dark part of your eyes. Okay, depending on whatever is your eye pigmentation. So this is the cornea. So corneal cirrhosis, cornea is getting dried up. Okay, or ulceration may also take place here. Cornea becomes dry, and if it is not treated immediately, this is a medical emergency. Corneal cirrhosis is a medical emergency. If it is not treated immediately, within few hours, okay, it will lead to ulceration, and once the ulceration has formed, it is non-reversible. Okay, you will not get back the eyesight ever. The child or the person will be completely blind for their lifetime. Okay, so it is not reversible. In your textbook, they have shown an image of uh, corneal cirrhosis of a girl child who is having corneal cirrhosis. The eyes have a lackluster kind of an appearance, and the complete cornea is keratinized. Keratinized means dried and hardened up. It is dry and hardened up. Okay, that is keratinized. And this lesion, this ulcer, can only heal by scarring. Scar has to form. If this ulceration has to heal, if this dryness, this dryness, if it was not treated, within hours it turned into a corneal ulcer. And if the ulcer has to heal, it has to scar. And as we know, if you have a scar, okay, the scar tissue will not have the functions of the tissue it has replaced. Okay, if you have a major scar on any part of your body, okay, that part of your body which has the scar, that specific area will not sweat because the sweat glands have destroyed. Okay, that scar area does not functions as your normal skin. It does not have any sebum production. It does not sweat. Okay, the touch, the tactile sensations on the scar is completely different as compared to other part of your skin. So definitely the functions are lost. Scar will make the functions lose. Okay, so you will lose the functions of the eye. So definitely this is going to be a uh, blindness category. Okay, yeah, the function of the cornea is to form images, to capture images, capture light and form images on your retina. So the function is lost. Now the person will be blind. Okay, then we have keratomalacia. This is kind of a final stage. Keratomalacia or corneal fundus, corneal scar or corneal fundus. So this here you can see the cornea has completely melted. Okay, cornea has completely melted into the conjunctiva. There is not much demarcation between conjunctiva and cornea. That is called keratomalacia. Melting and wasting or wasting. It is not reversible again. Okay. So the major work of the vitamin A prophylaxis program, nutritional program in India, is to stop these kind of blindness, stop nutritional blindness. Okay. Is it clear to all the different stages of night blindness, different stages of xerophthalmia, not night blindness, different stages of xerophthalmia, how it progresses forward if untreated, if it is left untreated? So next, coming to the evaluation of vitamin A or vitamin A deficiency or status. Okay, how do you check? So liver vitamin A concentration that I have mentioned earlier, when you do the liver biopsy and all, at least 20 microgram per gram vitamin A should be present in the wet liver weight. Okay, this is done in biopsies. Then your serum vitamin A level, most easiest way, give your blood test, do a blood test. You will understand the serum vitamin A levels. Okay, and if the vitamin A concentration in your serum, in your blood is less than 10 micromole per deciliter, it means that you are deficient in vitamin A. Okay, if the serum vitamin A level is less than 10 microgram per deciliter. Then we do the dose response test. So usually dose response test is not done on human beings. Okay, and it was actually done on some laboratory animals. Okay, small doses of vitamin A is given to a depleted person or a depleted subject. Okay, and slowly how much retinol binding protein the body is releasing, okay, that is seen, and based on that we will understand if the person has vitamin A deficiency or not. Okay, so usually it is not done on human subjects, dose response test. Then conjunctival impression cytology is done. Tissue paper or filter paper, okay, or blotting paper, what we say. If you remember in school days, when chemistry laboratory or in biology laboratory, when you used to do practicals, blotting paper was given. Okay, a filter paper or blotting paper was given. Okay, something very similar to that. Filter paper is brought briefly to your conjunctiva just to dab and get little bit moisture from your conjunctiva. Okay, very carefully. Okay, so that you don't hurt the eyes. So this blotting paper is used. It is kept in contact with the conjunctiva, and then it is taken away. And because there are some cells in that tear that covers your conjunctiva, okay, and these cells are, and which the blotting paper has absorbed, it will be seen under microscope, okay, to see that why these cells are seen under microscope, to see the health of the cells. Is it dry cells, or is it a good healthy epithelial cells? If you see a lot of keratinized or dry cells, it signals towards vitamin A deficiency, okay. If you have good vitamin A concentration in your body, you will not have keratinized dry cells in your conjunctiva, okay. But if the conjunctiva, the tears from the conjunctiva shows a high degree of dry keratinized cells, it signals towards a deficient state, okay. Then dark adaptation test is done, simple test, okay, the speed at which a person is able to recover from bright light to dim light, okay. And it is a kind of a complex expensive test, but it is not very useful with children, because uh, you want your subjects who are on whomever you're doing the test, they should be able to tell exactly what they're seeing, okay. And children can be children communicate on impressions, okay, what they imagine, they may say something about it. So these tests cannot be done on children, okay. So when you shift your patient from or subject from a bright light to a dim light, okay, and you wait for them to respond, okay, you see how long they are taking to respond, what are objects they are able to identify and see when when the vision slowly they're adapting to the dark vision, okay. So you need a person who can actually describe the things in front of them properly, okay, as it is. Then metabolic indicator, again blood test is done, circulating levels of retinol beta glucuronide is checked, okay, that is a metabolic indicator of vitamin A status. Low levels of retinol glucuronide means you have low levels of vitamin A. Then functional test is done. Functional test is like a biochemistry test, okay, that is not done frequently. You have to check your ammonia nitrogen levels in your feces, okay, or erythrocyte oxidative test from your blood, okay. These two tests can be done to find out if the person has adequate amount of vitamin A or not, but it's a biochemical test, okay, not that common. Then breast milk retinol, the health of the breast milk, yes, a sample of breast milk is also checked in the laboratory to find out how much retinol is present in the mother's breast milk. With that, you can identify if the lactating woman is deficient or not. Then tear fluid retinol. You can take the sample of the tears and identify the vitamin A concentration in that. In children also the tear fluid or retinol test can be done. So these are the different tests which you can do to evaluate vitamin A level. The most common and the most easy is to do a conjunctival impression cytology, serum vitamin A, tear fluid test, and if it is a lactating mother, breast milk retinol levels can be done. These are the easiest way of evaluating how much vitamin A concentration is there in your body. Okay. So these are the different results. You can see here, this is a micromole per gram. Okay. If your serum retinol, okay, if your serum retinol is is less than 0.1 micromole per gram, it means you're deficient. Okay, it has to be around 0.1 to 0.2 micromole per gram, then you are uh, kind of adequate. Liver sample, isotope, dose, breast dose response test, breast milk retinol, serum retinol. These are the different clinical tests that you can do, and different levels at which they show if the person is deficient, adequate, high, or are do they have toxic levels of vitamin A in their body. Okay, that can also be checked during through this test or through this reference table. So this you don't have to study, just for your information I have shown it here. It is not there in the textbook as well, just for your information it is shown here. So treatment, how do you treat vitamin A deficiencies? So vitamin A deficiency should be treated urgently, otherwise it could lead to irreversible blindness. Okay. Nearly all stages of xerophthalmia can be reversed till your conjunctival xerosis and initial stage of corneal xerosis can be reversed. Okay. And how can you reverse it? You have to give a massive dose of vitamin A. Okay, that is at least 2 lakh international units. IU means international units of vitamin A in the form of retinol palmitate. Okay, orally through syrup for 2 days, continuously for 2 days, give 2 lakh. And 2 lakh is also based on the age of the child. Okay, 2 lakh only you can give it to a preschooler. Okay, if the child is less than 1 year of age, only 1 lakh has to be given. If the child is less than 6 months of age, okay, only 50,000 international units should be given. So it is age dependent as well. But we know major cases of vitamin A deficiency is seen in preschool children. So 2 lakh is used here, okay, as a general statement. But it is age dependent, okay. All children who have corneal ulcers are given vitamin A. You don't wait for the test results to arrive. As soon as you get a child who has corneal ulcer, don't wait if you are in a clinical setting, okay. Do not wait for the lab reports to confirm vitamin A deficiency. Corneal ulcers will happen only if the child is vitamin A deficient. Immediately, without wasting time, give them the dosage, massive dosage of vitamin A. Okay. Conjunctival xerosis can be reversed. Okay. So this is the prophylaxis. Prophylaxis means treatment module that we use. Okay. Dosages that we use. So if the child is less than 6 months of age, as I mentioned, immediately on diagnosis, 50,000 international unit is given. Okay. How do you measure 50,000 and all? It comes in a syrup bottle. Okay. Vitamin A oral supplement. It comes in a syrup bottle with a special spoon. Okay. If you give full whole 1 spoon, okay, one full spoon, if you give to the child, it means 2 lakh international unit is given. Half a spoon, 1 lakh international unit. To one third of the spoon, if you're giving 1/3 of the spoon, 50,000, approximately 50,000 is given. Okay, so nurses and doctors, they are trained to give exact dose based on the age of the child. Okay, so on day 1 and day 2, 2 successive days, it has to be given, and after 2 weeks, same dose has to be followed. And after giving, after 2 weeks, when you follow the same dose, every 6 months you have to follow the same dose. Okay. So today you get a child who has severe vitamin A deficiency. Today you will give the first dose. Tomorrow you will give the second dose. After 2 weeks, you will give the third dose. And you will ask the parents to bring the child every 6 months. Okay, is it clear? If the child is below 5 years of age, every 6 months, vitamin A dosages has to be given. Is it clear to all how dosage is given to the children? Today first dose, tomorrow second dose, 2 weeks later third dose, fourth, fifth, sixth, seventh dose every 6 months. Okay. So any child less than 6 months of age, an infant less than 6 months of age, 50,000 international units. Between 6 months to 12 years of age, 1 lakh international unit. And if the child is above 1 year of age, adolescent or even adults, okay, above 1 year of age, 2 lakh international units should be given. After 6 months also the same pattern you have to follow. Okay. Now coming to the prevention strategy. Food that is rich in vitamin A, we have discussed in previous class. You can check the previous class recordings. So prevention, nutritional education, that is the first step. Okay. Under nutritional education, we have a lot of NGOs, government hospitals, research institutions, home science colleges, okay, private sector hospitals. They all can be used. Okay, these various sectors can be used to implement the awareness of vitamin A deficiency, vitamin A prophylaxis. Okay, ICDS, Integrated Child Development Scheme. ICDS means Integrated Child Development Scheme. They are also doing a lot of funding for these nutritional programs. Okay, under ICDS, lot of ASHA workers, community health nurses, community medicine doctors, okay, they all are trained to give awareness at community level, to go to each house, okay, do meetings, host community programs to give the awareness. Okay. Then CSSM, child survival and safe motherhood. Okay, child survival and safe motherhood, that is also another uh, another sub branch of ICDS. Okay, under five development groups are also there. Okay, these are different programs which are catered to specific group of people. Okay, especially for when it comes to safe motherhood, pregnant mothers, lactating mothers, and mothers of children who are under the age of 5. Okay, they also come under their category of receivers, service receivers. So under these programs, what they do, they ensure adequate intake of vitamin A and keratin rich food for pregnant mothers. Okay, to build up the pregnant mothers stores. If the pregnant mothers are not deficient, they will not give birth to deficient child. Okay, a child will be born with enough storage of vitamin A in the liver. Okay, lactating mothers also, initiating the breastfeeding mothers also with good vitamin A rich food. Within 1 hour after delivery, breastfeeding has to be initiated. Okay, colostrum has to be given to the infant. Exclusive breastfeeding for till 6 months of age. Nothing else has to be given. Exclusive breastfeeding. So supplements of vitamin A and beta carotene rich food like carrot, pumpkin, spinach, dark green leafy vegetables in pureed form. Boil it and mash it. Okay. Add a little bit of ghee. Why? Vitamin A is a fat soluble vitamin. When you add ghee into this pureed carrot, boiled and mashed carrot, okay, easily the absorption and assimilation will take place. Okay, this is the reason why we say when you have raw carrot and when you have slightly cooked carrot is much better than raw carrot. Okay, because in cooked carrot, slightly saute the carrot in oil, assimilation of vitamin A will take place very easily. Okay, because fat is required for the assimilation and absorption of vitamin A. Okay, so ghee has to be added. And if you're using fruits like papaya, mango, these has to be given to the infants from 4 to 6 months onwards, puree of these fruits. Red palm oil can be used. Okay. In preschool children also, regularly these foods has to be implemented. School children can be taught about the importance of vitamin A rich food so that they will go home and teach their family. Okay. Horticultural interventions, you can see here golden cassava rice. This is a normal white rice, and this is a bioengineered rice. Okay, bioengineered rice in which beta carotene has been inculcated. Okay, so it has that golden tint, yellow tint. Okay, beta carotene is a pigment. It is an antioxidant. It's a vitamin A, but it's a pigment. It gives the yellow orange pigment to the food. Okay, so golden rice, and also this is a golden cassava, tapioca. Okay, another name for tapioca is cassava. Okay, tapioca is something very commonly used in southern parts of India. Sabudana that you make, okay, sabudana is made up of tapioca. Okay, so this golden rice, golden tapioca is not that common in India, but in developing African countries, underdeveloping African countries, golden rice and golden tapioca has been incorporated to treat poverty and malnutrition and severe deficiencies there. Okay. What else you can do? Village level community nurseries. Every village should have a community level nursery where production of these bioengineered food, okay, production of beta carotene rich plants can be done. Okay, distributing the seeds and saplings of beta carotene rich plants and food so that every home at community level, at village level, every home has a papaya tree, every home has a small mango tree. Okay, and also krishi vigyan kendras, they in these kendras also there is more emphasis done on the production and consumption of fruits and vegetables which are rich in vitamin A. Okay, school gardens and kitchen gardens also something 20% or 30% of the school garden produces should be rich in vitamin A. So these things can be encouraged at community level so that the community awareness towards vitamin A increases. So this is some images of school garden, children participating in gardening, school gardening techniques, so that if young minds know the importance of a kitchen garden and school garden, automatically they will try to replicate the same at their own home. Okay, they can teach their own mothers as well, who may be or may not be illiterate, or they may not be aware about these things. Okay, so children can be used here as change makers in the community. And this is the syrup bottle which I was telling about, a vitamin A syrup bottle with a specific spoon. Okay, so one whole spoon means 2 lakh international units you have provided. Half a spoon means 1 lakh international units, and less than half a spoon means approximately 50,000 international units you have given. So this is a national prophylaxis program against nutritional blindness. Earlier, the name was vitamin A prophylaxis program, something like that, but then they have changed the name. Now this is a national prophylaxis program against nutritional blindness. Their main motto is to make sure uh, we can combat blindness, specifically nutritional blindness. No person in India should become blind just because they didn't had access to vitamin A. Okay. And fortification under prevention of infection. First of all, try to make sure that the children who suffer from measles, diarrhea, or any pneumonia, any respiratory infections, tapeworm infections, hookworm infection, that has to be treated immediately. Common infections in childhood has to be treated immediately. Do not keep it for long. Proper immunization has to be done. All the immunization and vaccinations under the age of 5, whatever they have to get under proper schedule, it has to be completed. Fortification. In India, Vanaspati is also fortified, but Vanaspati is not that good for health, so try avoid using it. But apart from that, milk, okay, not directly from the dairy farm, milk, packaged milk, compulsorily it is fortified with vitamin A and D. Oils in India is also fortified with vitamin A and D, especially for high risk areas, tribal areas, ration food and all, they come fortified. Low cost processed food for supplementary feeding is given for children. This is dalda. This is the fortified toned milk, a packaged milk. Every state has this their own form of milk societies, dairy societies. So they come under fortification rule. Biofortification, as I mentioned earlier, golden rice and cassava, okay, they are genetically modified, but nutritionally better than your regular white rice and regular cassava. This is an example of a boiled white rice, how it looks, and boiled biofortified rice, how it looks. There is no major difference in taste, just there is a difference in color. This is beta carotene rich rice. The main purpose of this biofortification is to give provitamin A to the third world, especially the developing African countries where malnutrition and vitamin A deficiency are very common. So that's about today's session. If you have any queries, mention in the chat box.